Welcome, everybody, to our DSAP Fall Speaker Series. My name is Masha Zaldonis, and I am the Administrative Program Coordinator at the Down Syndrome Association of Pittsburgh. Some of you I have met, some of you have yet to meet, so I look forward to seeing you at a program soon. So tonight we have Dr. Jess Patton with us, and for our speaker series tonight, she'll be talking about what is sensory processing. And to give you a little bit more background about Dr. Patton, she is a parent. Oh, and let me close my screen. She is a parent and a professional, and that's how she experiences the world of special needs. In addition to her 20 years in education, she is the founder and president of Sense of Connection, a nonprofit serving the autism community, as well as the owner of Patton Advocacy and Consulting. With her extensive experience, Dr. Patton understands parenting and working with children who have special needs can be filled with the most rewarding moments intertwined with some extremely difficult struggles. Using humor and a unique flair, she enjoys sharing her story with the intention of helping other parents and professionals. So she'll be talking about sensory processing tonight, how specific sensory input is processed, strategies to address these specific areas, and then at the end, we will answer questions that were submitted ahead of time, and then any other questions that pop up. So I had put this in the chat, but feel free to chime in with comments, questions as we go through her presentation. I'll be monitoring the chat, so you can feel free to message everybody or message me directly. And you are welcome to pop in with comments and questions as we're going through the slideshow. So I will interrupt politely and read the comment and the question unless Dr. Patton is covering it in her slideshow. So with that, please go ahead.
Hello, everybody. I just want to start off saying thank you so much for being here tonight. I know we were talking a little bit earlier that fall sports are in full swing. This is about dinner time for most families. And as we said, I am a parent of two teenage boys on the autism spectrum, and they also have blood clotting disorders. So I understand what dinner time can be like during this fall season. So thank you so much. The other thing I want to say is I'm recovering from a little bit of an illness. So if I'm raspy or if I cough, I apologize in advance. Please excuse me. So sensory processing, very interesting topic. Let's go ahead and dive in. So what is sensory processing? Some people term it as sensory integration, and it's the way our brain receives, organizes, and it responds to that stimuli, not only within our bodies, within our environment. So let's take that definition a little further. So what does sensory processing allow us to do? Well, basically everything. You think about it, we are inundated with stimuli from our senses all day long, right? This allows our bodies to be able to consistently and meaningfully and effectively be able to move about our environment and process things within our environment and respond appropriately. Sensory regulation. Let's talk about this for a little bit. And it's important we build this foundation of what does all this mean? Because our bodies naturally, to an extent, engage in this regulation of all these senses. And a good example that I use is sometimes when we're sitting in class, I notice that some of my students are bouncing their leg, or somebody's chewing on a pen cap, or that I'm a big culprit of this one. I pace around while I'm on the phone. And as you can see in the picture here, someone's laying flat on their belly, but they're still swinging their legs. That is all sensory input that I'm not sure that this person notices they're doing. But this is an example that we just do. Another example that I see a lot, people tapping their pens or clicking their pens, and they really don't know that they're doing it. We just automatically do it. So the common sensory systems, and it's important that we do recognize that we have 5 sensory systems, right? We learned this when we're little. We have visual, auditory, tactile, olfactory, and gustatory. So let's talk about visual for a second. Visual, we see with our eyes, right? Hearing, we hear with our ears. Tactiles are touch, and not just the touch on our hands. I know that's the picture that I have here, but I mean, we experience touch anywhere that we have skin, right? On our leg, on our mid body, on our toes. Olfactory, smell from our nose, and gustatory, anything that is taste, our tongues, our mouths, anything that process that food. But there are less common sensory systems, and that's what we're going to talk about tonight, because it's very important that a lot of our systems and our input goes through these three here. Vestibular, that's knowing where our body is in space. And so when I say this to people, sometimes they don't realize that, oh my gosh, that's a sense. Yeah, our body has to sense where we are in space so that we're not bumping and running into things and each other. Also, proprioceptive. That's our balance. That gives us our ability to walk, stand on one leg, to ambulate and move about on playground equipment and through like busy halls and malls. This last one, not many people know about, interoceptive, and it's what regulates our hunger, our heart rate, respiration, and elimination. So think about it this way, our body automatically does it, right? So we don't think about, oh yeah, we are hungry, right? Oh, my body's triggering that because of a hunger pain. Or my heart rate, I feel it beating faster, or I feel it beating slower when I'm calmer. Respiration, our body automatically does that for us. We're doing exertion and we're running and, really working our bodies, we're breathing heavier. Or if we're maybe laying down or relaxing, our body automatically, puts our rate of our breath a little slower. And elimination, well, we have our circadian rhythms that, well, we definitely know when we're not eliminating properly, right? So these are all things that just kind of happen automatically for most people. When it doesn't happen automatically for people, we look at sensory processing disorder. And I want to talk about Anna Jean Ayers. She was an occupational therapist in the 1970s, and she's the one that has credit for sensory processing disorder. And the way she terms it is difficulties in detecting, organizing, and interpreting sensory stimuli. And this is so significant that it causes impairment to our daily function. So without getting too into the neurological nitty-gritty of exactly what it is, a great way to think about it is a traffic jam. And think about when you're stuck in traffic and maybe you're in the far right lane and you need the far left turning lane. It's very difficult sometimes to merge all the way over. And there are different approaches. There's aggressive drivers and there are passive drivers. And so if you're an aggressive driver, sometimes we just step on the gas and we go for it and we cross all 6 lanes. If you're more a passive driver, you kind of cautionary, take your time, slowly moving over in each lane. And I use that analogy to kind of build a foundation for what I'm going to talk about later in the slides. But either way, however you approach getting from the far right lane to the far left lane, you're still in that jam. You're still having a difficult time getting to where you need to go. Or in some cases, finding the best route to get there. And what is so significant about sensory processing disorder is that it impacts all areas of an individual's life. So,
Dr. Patton, I'm sorry, one
yes,
question that popped up about
sure,
interoceptive sense.
sure.
Besides regulating hunger, does it involve a person's sense of being full when eating? Somebody wrote that their son has Down syndrome and needs to be prompted to stop eating at times when they've had quite a bit to eat.
It can. Now there can be other factors too that don't give the body a sense of satiation. That is more of a medical model question, and that would be something a healthcare provider could best describe or kind of guide better. But yes, that can impact the body's ability to know that it's full. All right, so let's go ahead and move on to sensory processing issues. Now, here's kind of a debate. This has been a hot topic for a while because sensory processing disorder itself is not recognized in the DSM-5. And for those of you who don't know what that is, that's our diagnostic and statistic manual. It's in the 5th edition, and the last one came out in 2013. It's where we have all our diagnostic criteria when an individual presents with some deficits or impairment or some sort of challenge. Clinicians and diagnosticians will use this manual to kind of give a diagnosis, a label, so to speak. It's best known as a symptom of autism, and that's kind of where it's quoted within the DSM-5. However, I really like to share this, and I strongly encourage our families and our communities to take a look at this, because not everyone with a sensory issue is on the spectrum. You don't have to have an autism diagnosis to have a sensory processing issue. I want to be very clear on that. We're seeing a lot of sensory processing issues and disorders coming from other developmental delays. ADHD, OCD, Down syndrome. So we're seeing that, there is kind of a crossover. There's a comorbidity that you just don't have to be autistic to have sensory needs. And I think we're really trying to grow in this area and really starting to look at the neuroscience behind it. But you can have a sensory issue and not have a diagnosis at all. And so this can be kind of confusing. And I just encourage everyone that is kind of going through this, just stop and take a look at the person, the individual, and the individual needs and strengths, and then go from there. So I want to highlight a little bit of the common onset, the symptoms, or what parents, families, caregivers may see with a child that presents with some sensory deficits or sensory impairments. Usually the onset's in the toddler years. They'll notice an aversion to noise and light and clothing. So for example, at a parade, maybe a fire truck's going by and the siren goes off and the child immediately grabs his or her ears. Their ears are too sensitive, or maybe they're not processing that sound appropriately. Or light can go either way. Some toddlers, they crave light. They want to look at the light and stare at the light, or they like flashing or blinking lights. Or some want to be in complete darkness or work in darker areas. Clothing. This was a big one in our house. We couldn't find a pair of socks without a seam to save the sock world. We couldn't. And so, our clothing had to be tagless. It had to be certain textures. Socks couldn't have lines. I mean, you name it. It was definitely aversive. I noticed some clumsiness. And what also kind of is an interesting fact, and I wish I had a picture to put into the slide, but I couldn't find one. My youngest son was a toe walker. And yeah, why that's a classic sign of autism. He was a dorsal toe walker. So if these were my toes, typical toe walkings like this, he was a dorsal toe walker. I mean, he walked on the tops of his feet, and that made him very clumsy. So just signs like that, you're thinking, that's a really intense input that my son is doing, walking on the tops of his feet, because we know how sensitive the tops of our feet are, right? So trouble climbing stairs, not being able to ambulate alternating feet, or judging depth perception is another kind of key trigger for an onset. Difficulty with fine motor. Now, while some of this is developmentally appropriate, like buttons, fasteners, grasping a pincer grip, that kind of thing, it does come a little later on in developmental milestones. But if you notice that your child is having difficulty with that, that could be an onset of sensory processing issues. More intense onset behaviors, screaming when face gets wet. Some of our children, and I notice this a lot working in the field of autism, when their face gets wet or something gets wet that shouldn't be wet, like their shirt or their pants or their socks, it's definitely an aversion, and it's an immediate adverse reaction, screaming, taking off the clothes, running away from the water source or running away from the clothes. Refusals to get dressed. This was a common one in my household. Did not want to get dressed because it was aversive. And actually, now that my sons are verbal, and I ask them about it. I say, well, why don't you like that? And my youngest son says it hurts. So imagine putting clothes on that hurt. Yeah. Usually a high or a low pain threshold. And so this is a more extreme one. Another example I use, my youngest son, my 13-year-old, he doesn't feel pain like we do. His pain tolerance is through the roof. He takes on a lot of pain, whereas if the same act would be happening to me, such as needle sticks, doctor's care, thing of that nature, I would probably be in pain, but he's not. And so that could be dangerous too. Crashing into walls, item, and people. A lot of our sensory seekers, which I'm going to talk about a little bit later on, they're very intense in wanting that input. And so they'll just crash, boom, bang, jump, and, hoppity skip into walls. And that could actually be pretty dangerous. And putting inedible or dangerous things in their mouth. And as we know, that could be very, very dangerous. That's definitely more intense onset there. So let's look at some challenging behaviors associated with sensory issues, tantrums. And when I say tantrum, I'm not talking a toddler meltdown because they didn't get the pack of gum in the store. I'm talking about tantrums that are uncontrollable, that are prolonged in time and duration, and they're super intense. So a good example is, if your child, let's say, wants that pack of gum in the store and they throw a tantrum because they didn't get the gum, if you buy them the gum, chances are they're going to stop and you give it to them. Now, inadvertently, you reinforce inappropriate maladaptive behavior, but that's another lecture for another day. But what I'm saying is there is a consequence to that behavior that gets that behavior to stop. With sensory processing issues, that behavior doesn't necessarily just stop like that. It's an intense feeling. It's an intense input of stimuli that just doesn't go away necessarily. And that's one of the theories or the thoughts behind prolonged, intense, and inconsolable tantrums due to sensory processing. The other important and very dangerous, could be dangerous, reaction is fight or flight. And we see some children that have such intense and adverse reactions to certain sensory stimuli that it turns into aggression, because they want that item or object, person, whatever, away from them, the smell, self-injurious behavior. We see that, when it comes to clothing, eyeglasses, maybe hair products, where they're pulling out their hair because they just can't take that intense smell, or there's some other things going on there as well. Elopement. And so a lot of times our children that are so overstimulated, we're going to talk about what that means here in a minute, they want to run away from it. And that's what elopement means. And our children with autism, I like to put this slide in here, not because I'm a morbid thinker, but because I want to be proactive about things, because autism and wandering to water. One of the biggest theories is that individuals with autism or other sensory impairments or sensory needs enjoy water. They crave water because it offers a sensory input that helps them get out of that dysregulation, that helps them regulate. But the problem is the number one reason why individuals with autism die is because of drowning. They just don't necessarily have the motor coordination to swim. They're not aware. They don't understand that water is unsafe or can be unsafe. So they like to locate that calming and stimulating, the feel of the water, the look of the water. Think about how the sun shines off the ripples of the water. I mean, how many of us go to the beach in the summer or go to the lake because it's a calming thing, right? So they're looking for that calming or stimulating situation or environment. And again, it's a definite health and safety risk due to the inability to self-regulate. They don't realize that what they're doing could be unhealthy or very unsafe. But keep in mind, this doesn't just happen to individuals with autism. It can happen to individuals who have sensory processing, not necessarily with a label or diagnosis. All right, so we're going to talk about what overstimulation or sensory overload means. I'm going to share just a little tidbit about myself. I become very overwhelmed in Walmart, and it's nothing to do with Walmart itself, or it could be maybe a larger store. I think it's because of the fluorescent lighting. I think there's a lot of people. I think there's a lot of noise, whether it's from the people talking or machines running or the coolers running in the background. There's just a lot of stimuli that goes on in a larger grocery store or big retail chain facility that I have a hard time with. I don't know if anybody else becomes overwhelmed in situations like that. And I consider myself neurotypical. So we put a child that's already struggling developmentally, it's already struggling to process things, and then we put them in a very overstimulating environment. That is a concoction for sensory overload. And it's too many browser tabs open at once. And if you looked at my laptop right now and you saw the 24 tabs across my screen, that's exactly what I'm talking about, because it's too many things going on at one time, and our computer bogs down. It slows down because it needs help. It can't process through all these things, all these commands that we're asking it to do. And so think of it that way, that our brains already are in a traffic jam. So if we have sensory processing issues, we're already jammed up. We're already trying to go from the right lane to the left lane in 5 o'clock New York traffic. It's a difficult task to begin with. And then you add the sounds of the motors running. You add the sound of horns honking, because we know when we're in traffic, we hear those horns honking. We also have pedestrians, people that walk out in front of us. We have to be aware of those individuals. And then we have the lights changing color. And depending what time of year you're driving, it could be getting dark. And up in New York, Western Pennsylvania, we get dark at 5 o'clock in the winter months. So what I'm saying is there's so much stimuli, and we're trying to get from point A to point B in a traffic jam. And then we add all this stuff. Of course, we're going to overload. Our brains can only take so much at one time. And it's when two or more of the body senses are experiencing this overstimulation. And it's actually a response from our sympathetic nervous system telling our body to go, hey, whoa, stop. This is too much. Too much. We need to calm it back down. We need to bring it back down a little bit. But it's very behavior triggering, because we go back to that flight or fight response, and we go back to the tantrum response. All right, I'm going to pause here. I know that was a lot of information that I just gave you, and I'm going to open it up. Is that okay for some questions here?
Absolutely. Yeah, and if anyone wants to unmute, please feel free. One question that did pop up is what your thoughts are regarding vagus nerve work to strengthen interoception.
So there has been research done on that. To me, it's a little bit inconsistent. I'm going to be honest with you. I definitely will give you some information for, she's a wonderful OT, and I will connect you with her. And she actually does some studies on that. If you don't mind, I will send you that information for whoever that was that asked that.
And I can make a note of that as well and
Thank
share.
you. Thank you. I appreciate that. All right. Any more? Are we good to go?
I think you're good to go.
All right. Okay. So we're going to break down into two categories here: hyposensitivity and hypersensitivity. So our hyposensitive individuals are termed our sensory seekers, or their undersensitivity. Our hypersensitive are sensory avoiders. They're oversensitive. And so from here on out, I'm going to talk the next couple slides, and we're going to refer to our hyposensitive kiddos and individuals as seekers. And we're going to talk about our hypersensitive as avoiders, just to kind of keep that clear, because sometimes we mix up hypo and hyper. And I just want to kind of make it a little more clear for us. So hyposensitive may look like, again, we talked about that extreme high pain tolerance, very fidgety, always moving and squirming, but enjoys that deep hug, that deep pressure. Again, spinning and movement, bouncing up and down, and not just bouncing little bounces, big bounces that are very, very intense. They bump and they crash into things. And I don't know, I remember as having children little, we'd throw them up in the air and toss them and catch them. And they just loved that. Just always wanting that touch, that connection, always wanting to touch different textures, and borderline inappropriate. We just can't run up and touch and feel people in public. Understanding that personal space is very difficult, obviously, because they crave that touch, that texture. And the other factor is they don't understand their own strength. And we're going to get into that a little bit more detailed. So that's our hyposensitive individuals. Our hypersensitive may still appear clumsy to bump into things, but it's not purposeful. They're just having a hard time navigating the space. Fearful of that high playground equipment, anything that moves or spins or bounces back and forth. Prefers the dark. Maybe does not like bright lights, blinking lights, or anything loud, piercing, or sharp. Again, this is where my son comes in. I use this example all the time, refusing to wear clothing. At a time in my life, raising little children, I actually toyed about putting a sign on my door that says, "Please knock, children may be nude," because we just had a very difficult time with that. Easily distracted, the humming of the fan in the background, anything that, normally or typically we would be able to block out, they would pick up on. It would be intense for them as well. Avoids physical touch, even with familiar people. And so, I talk about the huggers versus the non-huggers, right? There are some people that love to hug and love that greeting, that interaction, or that departure. And there are some people like me. I'm not a hugger. I'm not a toucher. It's just how I interpret that stimuli. Trouble with spatial relations and around objects and people. Again, bumping into things, being clumsy because they're having a hard time judging where that object is or where that person is in space, and having trouble with the amount of force applied. And we see that a lot with like being able to open and close scissors, very faint or light strokes when using a pencil or a writing utensil. So that's what I mean by that there. So we're going to divide each sense by a seeker and an avoider, and just kind of give you some examples and give you maybe some suggestions to kind of help out if you think that your child or a child that you work with or know, or an individual may have some of these things going on that we could help. So let's look at visual, our sight. A seeker may stare at the light or crave looking at blinking lights. Strobe lights are a really good example. Gravitates to that moving light on a fire engine. You know how they have the lights that go around? That may be something they gravitate to. Or they look at things closely or at an angle. So they're seeing something more intensely than we are, and they're getting a sensory input from it that maybe we don't see or we don't interpret yet. Or they sit too close to the TV, or they like to hold their electronics very close to their face. And they love bold, bright colors. Our avoider prefers dark spaces. A lot of the individuals that are in my classroom, my students, they like it when I turn the lights down low and I put on floor lamps. And the work production and the quality of their work actually improves because they are removed from that very intense stimuli, and it's reduced for them, and they're able to better think about what it is they're asked to do. Prefer the lights off, very soft pastel colors. Wearing sunglasses. So I have a student that actually wears sunglasses in my classroom because the fluorescent lighting is just way too intense that we typically see in commercial buildings like a schoolhouse. And they prefer the shade when they go outside, not that intense direct sunlight. So I hope some of this breaks it down and helps that maybe, you have an individual in your life that is a seeker versus an avoider. And then we're going to talk about what to do with that. Okay, auditory. Again, seekers, they love those loud noises. They love to put their phones or their headphones on full blast. Right in their ear, or if they're near a speaker, they love to be, right by that. They love those sharp, shrill noises, or the humming or the droning. I think about, when we have a fussy child, sometimes, and I've read this in some mom books, we run the vacuum cleaner because it can be a soothing sound to some of our individuals. And for some of the individuals I work with, that has carried over into their preteen tween life where, they still want that humming, that drone sound to calm down. For our auditory avoiders, they love the quiet, soft talking, sometimes no talking. And this is where the visual strategies come in, where, there's a lot of times in my classroom to give directions, we don't talk. We use a lot of visuals. We also do a lot of routine things so they know what's expected of them. And one speaker at a time. So we have a rule in my classroom that if someone's speaking, no one else is, because not only is it polite, but it also, helps drown out that extraneous of everybody else talking in the background. All right, so tactile or touch. A seeker touches everything, whether it's appropriate or not. And so they'll often jitterbolt off to go touch something that they want to experience. A good example is some individuals that are in a school building will run their hands down the lockers because they like the texture of the lockers or the brick wall. And sometimes that can be dangerous because depending on the texture of the brick wall, if it's really rough, you could hurt your hands. So their pain tolerance, again, is just they're able to tolerate a lot more than a neurotypical person. And again, they have their boundaries there are very blurred. The avoider prefers no touch. Actually, I have a student in my room that is so sensitive to touch, even brushing by this student is intense. And so, of course, he has an adverse reaction. We have to be very careful how close we get to this student to hopefully, not trigger a, overload of touch input. Does not want to be touched by people or things. And that includes clothing, that includes water. Sand is a big one. Sand's actually very aversive to a lot of people. Think about it. When you get sand in between your toes or sand in your shoes, that's a very difficult sensation sometimes. Olfactory or smell. One second. Sorry about that. A seeker. Smells items, objects, and people. So just so you know, in my classroom, I get smelled every day. And it's a greeting form for one of my students. And this student just, for whatever reason, finds comfort and calmness in my smell. I haven't figured out if it's my shampoo, my deodorant, what it is, my face wash, who knows. But it's calming for this student. And so they smell me every day appropriately. But it's a very interesting interaction. Seems to enjoy intense odors. So odors that, may be offensive to other people, like the smell of cooking onions or garlic, something that's very intense, they may enjoy. Has strong smell preferences. And so we talk about some of our individuals on the spectrum when they hit that body odor stage. And so a lot of our students, either don't notice it at all, or they're very offended by the smell of their underarms. And we're currently going through that in my household right now. I have a 13-year-old and a 16-year-old. And so I'm sure anybody else who has had individuals go through puberty, it's a very interesting sensory input that I thought about, but I really didn't think about until I'm in the throes of it. And I'm like, oh, Okay. All right. So it's just another thing you kind of have to navigate through, as a mom or a parent and a caregiver who have sensory kiddos. So an avoider, difficulty tolerating those strong smells. So my 13-year-old has a very hard time entering the kitchen while I'm cooking certain things. So I have to be very careful, what I cook, when I cook, where he is, because it does trigger behavior in him. New odors may be offensive. So changing your dishwashing soap, changing your detergent, your perfumes, it's things sometimes we don't think about as moms, caregivers, parents, and then we do it. And then we're wondering, why is our child acting so off? Why is things not going so well? And then, changed my scent. And it took me a while till I figured that one out too. But prefers familiar smells. All right, so let's head on to our taste. Our seeker puts objects, even though they should not be in our mouths, may put them in our mouths. That's where we see a little bit of pica. Choose on objects. And I didn't really notice this when I was in high school or growing up, but I remember children that would sit next to me would chew on their pen caps or chew on their erasers. And I always thought, ooh, that's so gross. And then I realized now that they were just seeking some oral sensory input. Lick items, and it's borderline appropriate sometimes. So that's something that we got to kind of control, plus the germ factor there. And intense spices and flavors. So my youngest, he seasons everything. There's a local meat shop around the corner, butcher, that they make their own seasoning, and it's pretty intense. It's very flavorful. And he takes the container and dumps it on everything he eats because he needs that oral sensory input when he eats. It's a very interesting thing. And I'll share a little bit more about what we did for him a little bit later on in the slides, if I have time. Our avoiders, limited diet. It's due to the textures. A lot of our children with oral sensory needs avoid certain textures that are maybe hard and crunchy, or maybe puddings that are soft and chewy. And it's all how that input is interpreted in their brain. They may prefer bland food versus the real intense spicy food. All right, vestibular, where we are in space. And we talked a little bit about this. I don't think we talked about the craving the fast. I often talk about my boys are into cars and they love drag racing. Well, drag racing goes fast, right? So sensory seeker there, they love that input, that sense of gravity pulling you back into the seat when the car takes off. And we talked about the other points there. The avoiders, avoid climbing, avoid riding a bike and standing on one foot, just because they're not able to judge where they are in space, and it's very scary for them at times. And they prefer their eyes open. And you're probably thinking, Jess, what does that have to do with sensory input? Well, a lot, because when you stand on one foot and you close your eyes, it's a lot different than standing on your one foot with your eyes open. So any yogis in here, anybody that practice yoga, a lot of times during some of our balance poses, the instructor asks us to close our eyes, and our whole sense of balance is totally different when you take out the element of sight. So individuals who are vestibular avoiders always want to keep their eyes open because it helps with that balance. And again, they may appear clumsy. All right, and proprioceptive for balance. And we talked about this a little bit. Our seekers always craving that input with those points there. And then we talked about our avoiders. Now, interesting thing here, they may rip or tear things easily because they're not sure how much force they're applying when they're gripping or grasping something. And they may pinch or grasp too hard. So I've had an individual before who would, non-speaking individual who would try to get my attention through touch. And sometimes this individual would pinch me. Not as a behavior, a maladaptive behavior or aggression, just because this person didn't know how hard they were trying to get my attention. So it was very unintentional, and we did have to teach a strategy for that. Slamming down objects. At first I thought that was a teenage behavior for my son, my oldest son, my 16-year-old. And it is borderline, but the other part of it is I noticed when he walks, he stomps his feet. When he moves through a room, he moves like he's on a mission. He get out of his way because he'll mow you over. And I just noticed then he's just an intense kid. He doesn't realize how much gusto and vip and vigor he has when he's moving through things and doing things with his body. Okay, so sensory issues, and you're probably thinking, okay, Jess just described my child, or Jess just described a student, or Jess described me. So a lot of times we go through these presentations and we recognize some things in ourselves, and that's okay too. So sensory issues. Now what do I do? Well, the only professional that can truly diagnose and help with sensory issues is an occupational therapist. That is in their training, their education, that's what they do. I will tell you, I'm not an occupational therapist. I do not study occupational therapy. I work closely with them personally and professionally. And they have given me a wealth of knowledge that I use with my own students and with my sons. There are two ways of connecting with an occupational therapist. One is through the educational model. Now, if you have students or children that are in school age settings, you can ask through written means your district for an evaluation, an occupational evaluation. They will send you permission to evaluate, and you can go from there. There is a process, just like anything else, that you have to go through the proper channels. And if anybody has any questions of that, I can get a little more specific. Private practice. Sometimes most insurances prefer a PCP referral, and then locating a pediatric therapy clinic. Now, we live in rural Pennsylvania. I live about an hour or so north of Pittsburgh. And so we just had our second pediatric therapy clinic open up recently. But I know there's other areas that don't have any pediatric therapy clinics. And I know there's areas like Pittsburgh that have a choice of them. So just make sure you're going through the proper channels. And I just wanted to make sure that we're clear. There's a clear difference between an educational model and then the medical model. And again, I'll get more in depth if anybody has any questions on that, on how about to have your child evaluated for occupational therapy services regarding sensory needs. All right, so let's go ahead and look at an evaluation. Again, I'm not an occupational therapist, but I've been a part of so many of these. I want to kind of give everybody the nitty-gritty of them. It consists of many elements, tests and assessments, observations, and teacher and caregiver input. And this is very interesting. Sometimes the teacher's input is totally different than the caregiver's input. And sometimes it's spot on. Our children don't necessarily act the same in the educational setting as they do at home. And there are lots of reasons behind that. But if you do go into an occupational therapy evaluation and you see that, don't be alarmed. Parental input is so important because nobody knows your child better than you do. Also to take into consideration is some medical history. A lot of times, individuals with already diagnosed developmental disabilities or prematurity are already statistically predisposed for some sensory issues. So I'm just giving you the overview of what an occupational therapy evaluation would look like, both in the medical model and the educational model. So let's just say that your child or your loved one does have some sensory processing issues. It's okay, right? One of the things that we see that is very, very effective is a sensory diet. Some people call them sensory treatment plans. I know in my classroom, we use it as a sensory diet. And that's actually how the children refer to it. It's just a diet. It's something they do every day, just like we have a diet that, we follow when we eat or when we exercise. The goal is to help the children or an individual reach and maintain sensory regulation. So what I'm talking about there is that throughout the day, we have influxes of sensory stimuli, right? And usually our bodies and our minds, our brains, we're able to handle all that. But individuals' sensory processing disorder, they may not be able to appropriately handle that. And so getting little bits of movement throughout the day, getting little bits of input through all the senses during the day in a timed manner. So a lot of individuals call it sensory breaks. In my classroom, one of the first things that they do when they walk in my door is they get presented with a choice board. Now, the choice boards are individualized. And so there'll be pictures or words, depending if they're word readers or picture readers, and they'll have a choice of movement. Say if I know that I have a seeker coming in right off the bus, they're seeking that movement. They want to move. They want to spin. They want to jump or swing. And so I know on that choice board that I'm going to have a picture of the swing, the trampoline, or the big exercise ball. And so they get to choose one of those items and they get to go and use that item. And we set a timer, and the time is definitely dependent on what the occupational therapist recommends for that individual. Again, this is all individualized. Does somebody have a question?
Policy count.
Okay. And so that is one of the first things we do right off the bat is provide them with the movement if they are a seeker. Now, if they are an avoider and they're coming in off from drop off, maybe the first choice I give them is the dark room, or I give them the weighted blanket, or they get their stuffy or their snuggly, whatever they choose. And so on their choice board, it's going to look different. They are going to have activities that helps calm them, not heighten them. So again, it's all individualized, and we can get more specific if we need to with our participants and our attendees today. But I hope that that helps a little bit kind of describe how we determine what activity the child needs when. So let me give another example. After they're done with that activity, the timer goes off. Their ability to focus and calm and do their work is better than if I were just to take them off the bus and say, oh, sit down, we got to do morning work. It may not happen because they're not regulated. Another thing to think about in the educational setting, in the classroom setting, is that when they're done with their work, or when you see they're starting to get to the end, or maybe they're starting to get frustrated, we prompt what's called a break, a sensory break. And that way they are able to calmly walk away from that activity, not ending that activity on a negative note. There's a whole behavior science behind asking for a break, but I'm going to kind of stick to the sensory end of it. They're asking for a break. They're ending that activity on a more positive note under their control, their choice. They're given that choice board again, and they can choose an activity that they feel their body needs. Now, again, as the adult, as the practitioner clinician, we manipulate what pictures are on that choice board. So if we know that the child's already overstimulated, jumping out of their skin, jumping out of their seat, I may not necessarily give them the picture of the trampoline, because that's just going to heighten their senses more. So we want them to come down a little bit, to calm down a little bit and regulate better. I may offer them the weighted blanket. I may offer them the rocking chair in the dark room. So, and we do that throughout the day. Now, some research does show every 15 minutes. Some research shows to let the child regulate or let the practitioner regulate that. And again, that's on an individualized basis. I truly believe that when we see our kids in the morning in the classroom, It could be different day to day, minute to minute. And I think that's why we have to be very aware of how behavior is communication. And I'm going to talk about that a little later in the slides. Does anybody have any questions on what I just talked about, the sensory diet and the sensory breaks? All right, we're going to move on.
I'm sorry, Mary Ellen.
Hi.
I did just write in the chat as well. So do students, in your experience, do some students develop an understanding whether or not they're a seeker or an avoider? Like, do they kind of recognize those terms themselves? And then do they tend, or is it more of a pattern that you're observing?
So I've had learners all ages, abilities, and honestly, it's individualized. And yes, I've had learners who will say, I need to jump. And they'll be able to tell you, or no lights, no
Yeah.
lights. So it did take time. It did take direct instruction. It did take a lot of visual cues, a lot of support at first, but eventually they did learn. Now, I do have some learners that still are learning their own bodies, and it's going to take a lot longer. It's an individualized basis.
Yeah. Okay, cool. Thank you.
Yep, no problem. All right. So what can our families do? And I kind of put this together because I thought about myself and I thought about the situation I'm in. I think about the families I work with through my advocacy and consulting firm. And I think about the common questions and the common solutions. Excuse me. And number one is teach and implement self-calming techniques. And we're going to go into these a little deeper here. Provide sensory toys and equipment, make time for movement, look for signs of distress, and have an exit strategy. So let's review these quickly. Look for signs of distress. Observe any consistent triggers. So a lot of our kiddos, they let us know, and it may not be say, hey, mommy, my skin feels itchy, but you'll see that they'll start itching. That's a big sign. Encourage communication. Remember, our kiddos can use multi-modalities, multiple means of communication. Communication isn't just speaking. It can be body language. It could be pointing. It could be leading behavior. And so we really need to look at those communication signs and symbols from our kiddos. Try to avoid the meltdown before it happens. Now, I know this is very difficult sometimes because sometimes we don't know when the meltdown's going to happen. We don't know the trigger of the meltdown. But if we know we're going to be in a situation where it could happen, be prepared. And we're going to talk about that later. What does distress look like for your child? And, learning those distress signs, those are so crucial. And again, because sometimes they can creep up out of nowhere, or a trigger happens that may have not been triggered before, or I love this, we prepare all this and we think something's negative going to happen, a trigger's going to happen, and all of a sudden it happens and there's no reaction. And it's like, well, wait a minute, before you had an adverse reaction to that, the same thing just happened and you didn't. So again, you never know, but always be prepared. And behavior is communication. Self-calming techniques, breathing. A lot of times when we get hyped up, we get overstimulated, we get anxious, we get nervous, we forget to breathe, or we hold our breath, right? I've caught myself a couple times getting nervous. We don't breathe properly. And so the first thing is to get in touch with that breath. There's some studies out there about sensory processing disorder and yoga. I encourage you to look it up. It's actually really, really interesting and really cool. It's definitely works on the balance. It works on centering the rhythm of the breath. There's so many good angles on it for yoga and sensory input. A sensory diet, as we mentioned before, and favorites. A lot of our children have favorite toys, blankets, activities, spaces, and locations. Use them encourage them, have some sort of communication or sign or symbol for them that our children can request them and use them before the meltdown happens. There is a picture going around on social media and it says something about, when you're an autism parent when, or, you're a special needs parent when, and the picture is of a mom and a dad or a family carrying around this backpack that's like three times the size of the individual. And it has all the sensory equipment. It has all the snacks. It has everything you need. And while that is, cumbersome, it's true. I feel sometimes as a special needs parent, we carry around everything because you just don't know what favorite blanket, what favorite snack, what item, toy, whatever it is you're going to need when you're out and about. Have an exit strategy. Again, you never know. Sometimes what was triggering in the past isn't triggering now, or something that was completely fine in the past is now a trigger for whatever reason. Or if you're going into something new, my son's father and I, we always are looking for the way out, just in case. Another thing is that I've noticed when we're out in public and we are around other people, and I don't feel that we have to explain ourselves, but we'll just say, hey, can we have the aisle seat, please? Or, hey, can we sit in this chair here near the exit? And typically people are very understanding of, not necessarily why, but they're just like, oh, okay. And, then they look at my boys and then they realize, oh, okay, maybe they do need to exit quickly sometimes. And do you have a signal? A lot of times families' signals to each other are nonverbal. They're just gestural or pointing. But, when in doubt, do you have a signal that, okay, we've had enough. We need to leave. We're trying to avoid the meltdown, or the meltdown is happening. We need to get our child out of all this overstimulation. And do you have something to bide your time until you get out? A lot of times our phones come in super handy, but when an individual's super overstimulated, that might even be overstimulating as well. So what are some alternatives that we have in our pockets or on our person or in that backpack that's 3 times the size of our bodies that we have to bide our time until we get out of that space into a more calming environment? Make time for movement. So this is kind of like our own sensory diet, but at home or in public or in the community. Exercise burns energy. And sometimes that's a good thing, right? It wakes our bodies up, gets us motivated to do things if we are an avoider. It also calms us down if we are a seeker. It releases body chemicals. I'm not going to get into the, body chemistry about it, but it relieves stress and calms our body down, regulates our sleep. We could do slow flow like in yoga or fast like running. And again, that's based on the individual and what they're needing at the time. Provide sensory toys and equipment. And so this is something that my nonprofit does, because what I found is that a lot of our families out here in the rural area have no access to sensory equipment like weighted blankets, putty or Play-Doh or swings or a trampoline. So one of the things my nonprofit does is we provide a $100 gift card to families who apply, and they are able to reach out. Our local vendor is Fun and Function. They're on the Philadelphia side of Pennsylvania, and families are able to use that gift card towards the purchase of sensory equipment to kind of help them out a little bit, because this stuff gets expensive, right? Especially when you're implementing a sensory diet or you have a seeker in one area and a avoider in another area, the next thing you know, your whole basement is filled with trampolines and swings and weighted blankets and tents. And so it also takes up a lot of space and it can be very expensive. All right. And my closing thought, because I wanted to make sure I left enough time for more specific questions that I can answer. You know your child best. And if you have that gut feeling, chances are your gut feeling is right. So you know your child best. You may reach out for support and help, but ultimately you as the parent know. Behavior is communication. So if you see a difference in behavior, there's a change in behavior or something just doesn't feel right, your child's communicating something to you. They may not have the words for it, or the ability to articulate exactly what it is, but they're trying to tell you something. And strengths and needs change over time. So if they are an avoider in the younger years of their life, they may hit puberty and be a seeker in certain areas of the body's sensory input. So don't, it can change. Well, that's one of the questions that we had is, can sensory deficits improve? And yes, they can over time. Prior proper planning prevents poor performance. That is definitely alliteration at its finest, but it's true. I think as special needs parents, we're always prior proper planning, so we don't have that poor performance. And that is definitely true in the area of sensory needs. And improvise, adapt, and overcome. We have to be flexible. We have to be able to read the situation, read the room, and oh, you know what? We got to implement that exit strategy. Or wait, they're doing super well. We get to stay and watch the whole show. Awesome. They get a super reward at the end. And closing thought, and I said this, the people that were on earlier before 7 o'clock kind of got a little bit of my background story. And I just encourage everyone, you're not alone. I felt alone for a very, very, very long time, that I was managing and doing everything, therapies, raising 2 children with, special needs. I thought I was all by myself, but you're not. I'm here, your tribe's here, your community's here, wonderful organizations like this that put on trainings, they're here for you. So try not to feel alone. I know it's hard, but we're here for you. So I'm going to open the floor for any questions. If Masha has anything in the chat, or anybody, want to raise their hand, or however you want to do it, let's go for it.
Yeah, I have some of the questions that were submitted ahead of time. You answered, will some of the sensory processing get better with age? So yes, you had said that already. Another question that was submitted said, for older children ages 5 and up with limited mobility, not yet independently walking other than swinging, what are some good activities to provide vestibular input?
The first thing I thought about when I saw that question is a sit and spin. Does anybody remember what a sit and spin is? Yeah. Okay. All right. Some of us do. Okay. So a sit and spin is a great way. Now, yes, you would have to use physical or hand over hand to help with that, but any sort of merry-go-round or spinning, anything that either goes up and down, not too fast, obviously, because stability is an issue, but anything that goes up and down and changes levels. There are lots of playgrounds. Matter of fact, we're putting in an adaptive playground here in our local school. And so there are so many cool and new pieces of adaptive playground equipment. I encourage you, it's called Maple Grove. It's in Ohio, though. It's quite a hike for some of us, but they have a huge adaptive playground. Look it up online, and they have great pieces of equipment there. Does that answer your question?
And if not, yeah, please feel free to message too.
Feel free to message me or drop in the chat.
And then another question that we have is someone who teaches yoga range of ages to individuals with Down syndrome. Is there a particular area of the body that takes more time to process movement or touch? Are there particular sensory tools to consider adding in? They use silks, mini beanbags, mats, and blocks.
Okay, I'm going to answer that with everybody's individual. So it's very difficult to say if there's one body part more sensitive to the other, because we're all different. But I will say that stability or exercise balls are a great way to incorporate into yoga. Also blocks. I'm not sure if I have any other fellow yogis here, but they use blocks, balance blocks. Also different textured mats. Are some interesting ways to get input through your feet and hands, or anything that's touching that mat. And there are definitely like foam rollers. Some of them are different textures. Some are flat, some are bumpy. There are some, and I forget exactly what they're called, but they look like stepping stones, but they're textured so you can stand on them and receive that input through your feet or through your hands. And I have more specific suggestions for the yogi question there. And I'll be more than happy to reach out to that person.
And another question that came up is, how do I encourage more diversity with food?
Well, and I'm glad that I read that because my 13-year-old, we ended up taking him to the Children's Institute, for feeding, and because there comes a point where, um, so I'll share his experience, not to scare anybody, but just to say how extreme it can be. He was to the point where he would refuse to eat for 4 days. And I would take him to the PCP, and the PCP told me he'll eat when he's hungry. So we actually employed very intense therapy down at the Children's Institute. We did have local feeding and swallowing therapy at a local pediatric clinic with occupational therapy, and it was not intense enough. So we definitely had to take him down there. When it comes to food, I'm very cautious because of my story. Not everybody's story is the same. Introducing textures is okay, but never forcing or force feeding anybody, because that becomes a negative associated with the negative. And I would never want that. It's okay to try and encourage, baby steps with food, like touch your tongue to it or put your lip on it, or just play with food. Food plays good. But as far as force feeding or forcing someone to try something, I do not encourage that. And if you're to the point where my son was, I definitely encourage professional intervention there.
And the last one that we had, it's a little bit of a longer one, but in class or a lecture setting, an individual will flip their pencil, wave it in front of their eyes unless they're engaged in something else. They've tried to redirect with taking notes, drawing, squishy ball, which they don't like. The individual tends to pick their nails, and they pick their nails even when not attending in this setting. If they're not redirected or engaged in school and the flipping or waving their pencil is permitted to continue, it'll go for 5 minutes of flipping and waving during a lecture. Then we'll continue during periods where they usually do engage with their surroundings, like group work or social times, or even walking down the hall. They like to read, but they'll read a book many times. They take the book to read in the car or even to a grandparent's house, and it's important for them to have. They read during quiet times, down times, and over the years, the family has tried to find a series that is more age appropriate so that they can have some more materials that are fitting for their age. And they'll try to read a new book, but it's hard to find new ones that they'll read till the end. So they read together. The individual does not get very upset if they forget a book, but they might briefly be disappointed and say that they forgot their book, and then they're okay, as would be common for others. And they have Marvel characters that are important to them to set up in their room, and they'll act out scenes from the books they're reading. They don't get upset if they need to be put away for any reason. So this individual is wondering if some of these behaviors, if they did not have perhaps a dual diagnosis of autism, their therapists have said they're seeking sensory input, and maybe a squishy thing or something similar would be used instead of a pencil, but then it grows from 5 minutes to all day if you let them. So they found that keeping them busy with activities or structured time helps break the cycle, because the cycle isn't great for them.
So that's a multifaceted question.
Yes.
So it sounds to me that they're wondering about comorbidity. And I mean, it's always a good thing to seek professional opinions. I can't diagnose, but I mean, seeking a professional opinion wouldn't be a bad idea. Also, it sounds to me, when they're engaged in lecture or not engaged and they're flicking, it seems like they're seeking some sort of sensory input, or they need a break. When we talked earlier about sensory diets and implementing appropriate sensory input at certain times throughout the day, it sounds like something like that would be appropriate to try, but again, under the supervision of an occupational therapist. I would definitely seek a professional's opinion in that situation. It sounds like they are seeking something.
And then a chat question asked if you work with adults. Their son with Down syndrome and autism, recently diagnosed, has become more sensory than they used to be. They recently restarted OT and are working on primitive reflexes, which feels very powerful in comparison to the work they did 22 years ago when they first became aware of their sensory processing issues. They'll see a neuropsychologist to explore neurological issues, but finding it challenging to find the best supports since so much is focused focused on children rather than adults. Any suggestions? They live in about an hour and a half north of Pittsburgh, and then their OTs in Erie.
Oh, wow. Okay. So up in Erie area. Yeah, there's actually some supports that I am aware of up in the Erie area. I'll be more than happy to connect with that family. But yes, I do agree that there are many more advances in occupational therapy than 20 some years ago. Approaches have changed, science has come out, research has definitely shown the way. And so, yes, I'm sure there is more movement now than there was 20 years ago. And yes, a lot of our families that have adults with special needs do find some frustration with finding supports and resources and services. And hopefully that can change. And I think we're seeing a movement towards that. So yeah, I'd like to connect with that family.
Perfect. I can do that. And the very last question that I have was submitted by a dental student, and they had asked for tips for handling sensory overload and meltdown, especially given in a dental office, specifically that setting, with the stress and the stimuli, since they
Yes.
were looking for some strategies.
And actually, funny thing is, my father-in-law is a dentist. And so, this question has come up several times because he does see patients with a variety of needs and strengths. And so, honestly, it's a individualized thing. I keep saying that again, but no two people with sensory needs are the same. A lot of times we keep their hands busy. A lot of times we do it's more of a social story. We get more into a behavior strategy. But there are some sensory things we can do. A lot of times, a lot of massage, a lot of stimulating, we use knuck brushes to desensitize. So there are many different strategies that an OT can implement versus what I can implement. I can only implement it under the supervision of an occupational therapist. But definitely that would be something that they could do to help that family, or I'm sorry, that dental hygienist technician, through to maybe have a training and say, yeah, you know what, if you are working with clients, then let's talk about this. How can we desensitize them a little bit? Because, oh yeah, the lights, the drill, the noise, the smells. I mean, it's an all-encompassing, overwhelming sensory experience. For me, I couldn't imagine if I couldn't interpret or process sensory input typically. So yeah, that would definitely be something that an OT could come in and help them with at their clinic or practice.
Perfect. Thank you. Well, that was all the questions that were submitted ahead of time and through the chat. So thank you, Dr. Patton, for the presentation, for going through the questions. Thank you, everyone who joined. And if you'd like Dr. Patton's information, I can contact you. I can connect you all together, share your email address, and connect you with the families and go from there. So thank you very much.
Thank you, everyone. It was a true pleasure tonight, and I hope that I helped someone. So thank you very much.
Thank you. All right. Have a great night, everybody.
Bye.